I think we had concluded with one introductory session for PGenomics and personalized medicine, where we understood about the latest development of the genomics, okay, and what are the technologies which are emerging in the field of genomics and personalized medicine. So that was our introduction to understand briefly that what are the emerging trends, so that you can better absorb the concept from the root, okay. So in today's session, I think this is the very first lecture of our course. Previous lecture was all about introduction and basic thing to understand the importance of genomics, and today's session is all about basics of genomics and personalized medicine. We are started from the root, okay. So we will discuss about the importance based on case study, which is true and which is published in the Lancet. So we'll start with the case study, and further we will understand the importance of genomics. What is the importance, right? Because we have enough understanding of gene and drug interaction now after the introductory session, but we didn't understand any case study in detail. So we'll start our session today with the case study, and further, we have a human genome project, what it is, what its importance. We will discuss the ethical consideration. We'll discuss today the basic concept of pharmacokinetic and dynamics, and how the clinical implementation of the both of the terms has role in, or we can say has relation with genomics and personalized medicine. Okay, so these are the concept of today. We'll discuss the learning objectives first, and we'll proceed forward with the PPTs. Okay, so I hope you guys are making notes, and you are doing, preparing your notes very well, because at the end of your 10 to 12 lectures, you will be having one exam. Okay, and the minimum criteria is there to pass it. So to get the certificate basically, so please try to present in the class and engage yourself as much as you can. So ask question at the end of the session. You can simply unmute yourself or put the question in the chat box, and we'll try to resolve it. Okay. Okay. So without further delay, let's get into it. I'm sharing my screen with all of you. Okay. I hope it is visible. Okay.
Yes,
So
it
this
is. Please go ahead.
Okay, thank you. So, this is our course title, Pharmacogenomics and Personalized Medicine. And we will try to discuss our basic concept, introductory concept for it with the case study. Okay. So, this is the very first lecture to understand our genomic concept, and which is basically of introduction. Okay. So, we'll see how the definition emerged, and how the concept evolves, and what its relation with personalized medicine today. See, why I am dedicating two whole lectures for introduction, because sometimes you understand the whole concept of it, but you don't know the very basic thing about it. So you have to understand the clarity, okay, and the importance of the term, because once your why is strong, then and then it will be very good to implement in a practical way. Okay, so it is not like understanding only the theory, but I need that after this course you will be able to implement this concept in your daily practices. This is my aim. Okay, so we'll try to do it and understand it based on case study, so that you can also implement the same theoretical knowledge in your clinical practices. Okay, because without the practice, this theory concept means nothing. Okay, so all should be agree with this, and please understand in a broad way. This genomic is a very broad concept. You cannot have a narrow mindset to understand it, so you need to have broad mindset to understand the concept clarity of genomics. Okay, so we'll try to resolve it in this session. So these are our learning objectives and for today's session, and these are clearly have has the very basic things. First, we have importance of genomics based on case study. which includes its definition and the role in patient care. So, how you can have a practical implementation in patient care, right? Next, we'll try to understand the Human Genome Project and its importance. We can say the pharmacogenetics is somewhat older term and pharmacogenomics is somewhat recent term, right? So ह्यूमन जीनोम प्रोजेक्ट बहुत ईयर से प्रैक्टिस हो रहा है, लेकिन वी आर हैविंग सम इमर्जिंग टेक्नोलॉजीज इन ह्यूमन जीनोम प्रोजेक्ट ऑल्सो, right? So what it is and how its importance in our healthcare is, how it is affecting, we'll understand it. Then next objective we have, that is the key concepts. So we'll understand what are the pharmacokinetic profiles, ADME, and what are the pharmacodynamics, how drug is going to be act on the body. Okay, so how body, what body does to the drug and what drug does to the body, we'll understand both of the things in detail. I think many of you are aware of this, both of the terminologies, because once in a while, I think in your co-logy you will be having this concept, right? Kinetic and dynamics. But in this session we'll understand how this both of the terminologies has relation with genomics and personalized medicine. Okay, so this is very basic again. Then we'll see what are the role of genetic variation in drug response. So if the person is having any kind of mutation in gene or any kind of genetic variation, what will be the effect of drug? I think in very first lecture we have understood about the poor response or ultra rapid response, etc., etc. We'll see how the genetic variation affects drug responses. Okay, and last point we have, that is ethical consideration. We have one separate lecture on this topic, ethical consideration, because when you implement this personalized medicine in your practice, you will face some ethical issues. Okay, so we'll try to solve it one by one, that what are the issues and how to overcome it. Okay, so we'll see ethical consideration in our the whole different lecture, but in today's session we'll brief it out कि क्या क्या problems आ सकती है in implementation of genomics and personalized medicine. So I hope the objectives are clear now so that we can proceed further to the PPTs. Okay, these are very basic and understandable objectives. Let's understand the definition. First of all, pharmacogenomics, very basic. Pharmacogenomics that are having consisting of two different names, and one is pharmacology and one is genomics. Okay, and that's where your definition stands. Pharmacogenomics, study of how your new genes affects person's response to the drug. See, in many area or many reference book, in many online sites, you will be finding different definition of pharmacogenomics, but here where it comes to the concept clarity, we will be having a simplest definition. Okay, that pharmacogenomics consisting of two different terms, ecology and genomics, and when you will be having how new genes affecting person's response to the drug, and you study that thing, that makes it whole definition pharmacogenomics. Okay, so ecology means the science of the drug. You will be having ADME and the drug response key, what is body's response to drug, what drugs response to the body, the whole concept that is having kinetic and dynamic profile, that comes under the ecology. Basically this is the science of the drug, and genomics is the study of genes and their functions on the body. Okay, on body means we can always say, see, it is not like response particularly to the drug, but genes are responsible for many other mechanisms also, which can directly or indirectly trigger your drug responses. Okay, you cannot say directly that genes are only responsible for the drug response, but it is one of the reasons behind the variation of efficacy of your treatment. Okay, so this is how it's working. The study of genes and their function, genomics, and the science of the drug, ecology. And when you combine both of these terminologies, then your definition comes genomics. Okay, and what its purpose? To develop very effective, safe medication that can be prescribed based on person's genetic makeup. So इन इंसान का क्या जेनेटिक मेकअप है, वो किस तरह से रिस्पॉन्स करेगा, कौन सी दवाई को कौन से डोज में देने पे पर्सन्स का जो रिस्पॉन्स है वो काफी अच्छा और मैक्सिमम रहेगा, दैट स्टडी means pharmacogenomics. Okay, so we are having genetic testing. Okay, so we'll be having genetic testing, like patient में कौन सा enzyme की कितनी category है, right? And what is the category patient is situated in, poor metabolizer, rapid, ultra rapid, etc., etc., and based on which we are modifying the dosage regimen, intervals, or alternative suggestion because of the susceptibility or resistance. That is the personalized medicine. Okay, so genomics and personalized medicine has interlink. Okay, so I think the definition is clear. Ecology, genomics, the science of the drug, the study of the genes to develop the effective, safe medication that can be prescribed based on individual's genetic makeup. And if all it combines, it makes the term pharmacogenomics. Okay, I think it is clear. Okay, let's understand the importance of genomics based on case study. Now, I request you all to imagine a case scenario in your mind, how the story is getting progress. Okay, so let's have a case. So here is the case. Imagine you are a new mother having just given birth to a healthy baby boy. What happens next? Unfortunately, the delivery has left you with the debilitating postpartum pain, which is again common. Okay. So what happens next? It was we can say there is unbearable pain. Okay. So patient again visit the doctor, and your doctor prescribes you a painkiller which really helps in normal individual, but it also makes you feel drowsy, tired, and sometimes constipated. These are minor and we can say modifiable, we can say adverse drug reaction that can be tolerated, right? So once the painkiller has stopped, these are the side effects that can be resolved. So it is not that serious. So again, I am saying you are a new mother having just given birth to healthy baby boy. Unfortunately, this is resulting into postpartum pain, and doctor prescribe a painkiller which really helps but having a minor side effects. Now understand what happens next in the story. At the same time, you notice that your son isn't breastfeeding very well. Okay, it is trouble in the breastfeeding, and your son is not getting the breastfeeding very well. So you again visited doctor, and the doctor reassures you that everything will be fine and recommends you to store the excess breast milk for your convenience, and you go home relieved. Okay, and what happens next is we cannot imagine, but one day your child doesn't wake up. Okay, so it is a child death. Now you can imagine the scenario, right? It is very very questionable because it was healthy at the time of birth, just the mother having painkiller for the postpartum pain. At the same time, the son isn't breastfeeding very well, so doctor reassures that please store your breast milk for your convenience, and then you go home relieved and practice the same thing. But one day the child doesn't wake up. So, what happens next? His skin is gray and he is not breathing. Frantically, you call hospital, but it's too late. Authorities arrived and autopsy is done. And what they found is this: extremely high level of morphine found in baby's blood. Now, codeine was the drug that was prescribed as a painkiller to the lactation mother. Codeine was the drug that was prescribed to lactation mother, and after the death of the baby, the autopsy was done, and extremely high level of morphine was found in baby's blood. I think in very first lecture we had discussed about CYP26 enzyme, which is responsible for your codeine to convert into morphine. You can imagine here and connect the dots. Mother should be ultra rapid category, so normal dose पे उनके बॉडी में क्या हुआ, कोडेन इज गेटिंग converted into excessive morphine, and that can be transferred by the lactation or by the breastfeeding to the child, and then child death, the reason this is becoming the reason behind child's death. Okay, so extremely high level of morphine was found in baby's blood. Now, this is not a story. This is the published case report. You can see here pharmacogenetics of morphine poisoning in the breastfed neonate of a codeine prescribed mother. And this is prescribed in the Lancet 2006. See here, this is this true case study published in the Lancet back in 2006 under the title Codeine Effect. Now, this is the seriousness of pharmacogenomics. Okay, so we are learning the concept which is the reason behind the neonate death because of prescribing a simple painkiller. So I hope now you are having the clarity that why we are studying today pharmacogenomics. As a healthcare professional, we should be aware of this concept and this case, which was, one of the greatest example why this is so important to practice. Okay, so this is the codeine effect case. This is the chemical structure of codeine, and when the CH3 group, which is methyl group, that can be removed by your CYP2D6 enzyme, and that can be converted into morphine, which is a potent painkiller. Okay, because codeine itself, it is non-active, right? And that can be translated, or we can say that can be transfer into what active form, which is morphine. So let's understand again. This was the drug that was prescribed to the mother, Tylenol number 3. Okay, codeine is found in the Tylenol number 3, a painkiller which is prescribed to many new mothers to relieve the postpartum pain. So that was very common. Yet the vast majority of these breastfeeding mothers have healthy babies. They are not having any problem. As in a very first lecture we have discussed, in very rare case, 1 to 2% people falls under the category of ultra rapid one. Okay, and this mother was one of this category. Okay, ultra rapid. Otherwise the babies are healthy after the patient is having Tylenol number 3. So what happens in this case, let's understand. इस वाले case में क्या हुआ? Because majority of the breastfeeding mothers have healthy babies after taking Tylenol as a painkiller. So what's new in this case? What are the interaction? It is gen and drug interaction. Okay, let's understand this. So what happens in this case? See, when the drug is getting into the system, this is the flowchart that can be understandable, right? Drugs are either metabolized by the phase one. Phase one are having your majority of CYP enzymes, CYP 450 enzyme category, which is the vast category of enzymes responsible for metabolism of n number of things in the body, including drugs. Okay, that can oxidize your drugs, and then it will be having another phase two mechanism, basically detoxification pathway. Drugs can directly move also from the detoxification pathway and get into the conjugation part, that is the drug detoxification. Basically it is the breakdown of the particles and getting absorbed and target, reaching to the target site. And another way, that is the phase 1 and phase 2, both is responsible to convert your drugs into reactive metabolites which are toxic. So this is simplest mechanism. Either they can reactive metabolites can directly convert into toxicity, either they can some of them, some of its part, converted into again a detoxification pathway, and then the metabolism, ADME takes place, and metabolism reaching to target sites, and then having effect and again excretion from the body at the time. Okay, so this is the simple mechanism of your drugs. Okay, phase 1, phase 2, or the phase 1 2 combined. So what happened in our case? Let's understand. See, this is another flow chart to understand that drug can be having two of the mechanism. They can be either converted into inactive metabolites, so loss of the drug activity, we don't have any kind of effect in the left side, inactive metabolites, and on the right side, the drugs are getting converted into active metabolites with the enzyme help. Okay, so with the help of the enzymes, drugs are converted into active metabolites. Active metabolites again can have different biological activity, can have toxicity, or altered drug activity. Various possibilities are there. Okay, so these are the simple thing, and these are our CYP450 enzymes required NADPH as a and NADPH as a energy portion, but these are responsible to convert your drugs, okay, into this active formation. So the role of CYP 450 in the drug metabolism is various. They can be have normal binding or competitive inhibition or non-competitive inhibition. Okay, so this is another topic to discuss again, the role of CYP in drug metabolism. But I think in your pharmacology, you will be having very basic it is, and you will be having in very first semester, or when the ecology comes, very first thing to understand is the role of CYP 450 in drug metabolism. So here I am not going deep into this theory because we are aiming for genomics. So we'll try to understand what is the link between pharmacogenomics and CYP450. Okay, but I simply put the diagram to understand there are various roles of CYP450 in drug metabolism. So let's understand there are over 50 different isoenzymes. CYP450 के बहुत सारे isoenzymes है. CYP2D6, CYP2C9. Okay, there are various enzymes, 7 of which are involved in metabolizing over 80% of your medicines. So what are they? This is the graph to understand. See here, the majority of are having the CYP3F4 or 5. 30% of drugs are getting 30% of the drugs are getting metabolized by it. The next category, 20%, CYP2D6, comes the codeine, warfarin, right? So CYP2D6 is the major. Again, 20% are responsible, and somewhat miscellaneous you will be having here. The example, CYP2C9, 13% hai. Then we are having a 9%, right? This is CYP1A2, then 7% CYP2B6, 5% CYP2C8, 3% पे हमारे पास तीन है, CYP2A6, CYP2J2 and CYP2E1. So these are again miscellaneous enzymes, but these you can have examples of CYP3A4, 5 and CYP2D6 and CYP2C9. Okay, so these are major, and 80% are responsible to metabolized, okay, by this, by helping with the help of these enzymes. Okay. Okay, so let's understand again our Lancet case. क्या हुआ था? For our case, let's focus on the CYP2D6, which are the 20% coverage, and we have codeine drug. So codeine is always getting metabolized by CYP2D6. Okay, let's understand what happens. The CYP2D6 gene sequence that is varies between people. अलग अलग लोगों में अलग अलग जीन की सीक्वेंस होती है CYP2D6 की, and this genetic variant, or in another word we can say alleles, results in slight structural change in CYP2D6. This is happening, which makes difference in poor metabolizer or ultra rapid metabolizer, right? The slight structural change in gene, which further altered how effective your enzyme will be at metabolizing drugs. And broadly, they can be classified as normal function, decreased function, or non functional at all. Okay, so normal function means metabolizing quickly as necessary, decreased metabolize very slowly, and non function means there will be no metabolism of the drug. Okay, this is very rare condition. Let's understand. Since we inherited, each person actually inherited a copy of each gene from each of the parents, one from mother, one from parent, okay, one from father. Each person have two CYP2D6 alleles. Now please understand here what is happening. Based on the combination of person's CYP2D6 alleles, they can be classified as, population can be classified as extensive metabolizer, intermediate metabolizer, poor metabolizer. Okay, again I am saying two genes or two alleles are responsible to make a copy of gene. Okay, and each of is inherited from each parent, and person is having two alleles. Okay, alleles we can say, alleles we can say. What is the meaning of extensive? सो नीड्स एक्सटेंसिव कैटेगरी में आने के लिए, फास्ट मेटाबोलाइजर कैटेगरी में आने के लिए, अ पर्सन नीड्स एटलीस्ट वन फंक्शनल अलियल, वन फंक्शनल और टू स्लो. Okay, one functional allele or two slow allele to be a rapid or extensive metabolizer. Okay, which is the normal category. What it comes to intermediate, one slow allele and one non functional allele. तो एक पेरेंट का स्लो एलियल अगर आया है एंड एक से नॉन फंक्शनल आया है, तो यू विल बी हैविंग अ कैटेगरी ऑफ इंटरमीडिएट मेटाबोलाइजर. And as its name suggests, poor or slow, two non-functional allele to be a poor or slow metabolizer. All of the category, 99% of category can be classified under these three categories: extensive, intermediate, and poor. Only a 1% is classified as ultra rapid, where two functional alleles तो है ही, उसके साथ एक और प्लस होके आता है, right? So this is ultra rapid one. So let's understand this. I think this is clear. We have schematic diagram also to understand this. Do not mug up anything. Okay. पूरा इसको रटना नहीं है. You will be having one graph to understand it. See, I think in very first lecture I have included this picture, and I told you that in next lecture this picture will be clear. So now the meaning should be clear. See, percentage of CYP26 metabolizers. Very first category, 77 to 92% are having normal, which again term has rapid metabolizer. Where see here the N is stand for normal function allele, D is stand for decrease functional year. Cross is stand for non-functional. And we are having percentage also. Okay. So to fall under rapid or normal metabolizer category, persons are having four different options. So if person is having two normal function allele, that can be classified as rapid metabolizer. If one normal and one decreased, तो भी क्या होगा, रैपिड मेटाबोलाइजर, बिकॉज वन एक रैपिड मेटाबोलाइजर की कैटेगरी में फॉल होने के लिए वन नॉर्मल अलियल इज मस्ट, ओके, और टू डिक्रीज्ड इज मस्ट. सो सी हियर टू नॉर्मल अगर होगा तो भी रैपिड मेटाबोलाइजर है, वन नॉर्मल वन डिक्रीज है तो भी रैपिड है, वन नॉर्मल वन नॉन फंक्शन है तो भी रैपिड है, मतलब नॉर्मल है, और टू डिक्रीज है तो भी दैट विल बी अगेन माइनस माइनस प्लस जैसी सिचुएशन है. दो डिक्रीज अलियल्स है तो भी वो रैपिड मेटाबोलाइजर की कैटेगरी में फॉल होगा. ओके, सो दिस इज द possible mechanism for rapid metabolizer. Next we have intermediate, where 2 to 11% people falls, where the possibility is only one. One is non-functional and one is decrease. Now there will be no normal, because normal allele अगर है तो person का दूसरा allele कोई भी हो, that can be classified under rapid. सो यहाँ पे कभी भी एंड तो आएगा ही नहीं. इंटरमीडिएट मेटाबोलाइजर में वन इज नॉन फंक्शनल एंड वन इज डिक्रीज्ड. ओके, तो एक बिल्कुल ही काम नहीं कर रहा है, एक डिक्रीज फंक्शन में कर रहा है, तो दैट विल बी इंटरमीडिएट. व्हाट इज पुअर? पुअर मीनिंग दैट आर the person is not able to digest anything that is having the help of enzyme, okay, that requires the help of enzyme, where the possibility is only one. Two non-functional, तो दोनों अगर non-functional है, there will be poor metabolizer category. See here, only 1 to 2% are having the category of ultra rapid metabolizers, where more than two normal areals are found. So दो तो normal है ही, उसके साथ एक और जुड़ जाता है, that makes the person falls under the category of ultra rapid metabolizer. अभी सबसे मुश्किल काम क्या है कि इसको आइडेंटिफाइड करना, राइट, बिकॉज वी हैव अ ग्रुप ऑफ पॉपुलेशन, एंड ये कोई ऐसी बात नहीं है फीवर जैसी, क्या कोई डिजीज जैसी, कि आप सिम्टोमेटिकली क्या उसको देख के कि ब्लड टेस्ट करके कि कुछ भी करके यू कैन आइडेंटिफाई कि पेशेंट का कौन सा मेटाबोलाइजर का टाइप है, राइट. सो चैलेंज स्टैंड्स हियर. सो वी हैव मिक्स पॉपुलेशन एंड वी नीड टू हैव जेनेटिक टेस्टिंग टू आइडेंटिफाई कि पेशेंट में कौन सा अलियल प्रेजेंट है एंड पेशेंट कौन सी कैटेगरी में फॉल होता है, राइट. एंड बेस्ड ऑन दिस you need to identify the dosage which is suitable for individual person. This is personalized medicine, right. So this is the diagram. I think this picture I had uploaded in the very first lecture, also introductory, where I said this will be clear in the next lecture. So I think now you have understood about the whole the meaning of this. Okay. Okay, so the majority of people are, again I'm saying, rapid metabolizer. Rapid means normals. In rare cases, person can be classified as ultra rapid one. Okay, so this is again the picture to understand. Ultra rapid category बहुत rare है. Green में आपको दिख रहा है यहाँ पे. These people have three normal alleles. As I earlier said, दो normal तो है ही green color के, but एक और जुड़ जाता है. Okay, alleles of CYP26 rather than two. Due to which category? Gene duplication. Gene duplication is a mutation, and mutation in gene means genetic variation. Okay, now you have a link कि कैसे genetic variation drug के response में help करता है, right. So once one minor change in your gene can affect your absorption of any kind of drug. I'm not saying any kind of, see, n number of anti-cancer agent has make direct link with genetics, right. But I am taking a simple example of painkiller. Now understand the deftness of this concept, because a simple painkiller has relation with genetics. So is it safe to take any kind of medicine without prescription or without this kind of mechanisms to understand? Not at all. Okay, we are not studying any kind of antidepressants और एंटी कैंसर एजेंट्स और बड़ी बड़ी जो दवाई है, हम सिंपल पेन किलर का एग्जांपल लेके समझ रहे हैं. स्टिल द चाइल्ड डेथ was the case. So it was not it was not at all, we can say, negligible, right? So they metabolize certain drugs extremely rapidly and efficiently because they have more enzymes in the body because of three normal alleles. Now, changes in the metabolism can alter the effectiveness of the drug. Toxicity of the drug can be happen. Simple to understand. Again, this picture is here to poor, intermediate, normal, rapid, ultra rapid. Sometime you will be having this classification also. So इसीलिए मैंने यहाँ पे include किया है. Sometime rapid को ही normal दिखाया जाता है. Many different reference book has different classification. So sometimes they are classifying based on this five categories: poor, intermediate, normal, rapid, and ultra rapid. Sometime you will be having normal and rapid same category. Okay, so do not get confused. As I earlier said, please have a broad mindset to connect everything, because different reference में आपको different classifications मिल सकते हैं. Okay, but generally normal and rapid are safe. That's what you need to understand. So now consider, if all of the types of metabolizers were given the same codeine dose, what happens next? अगर सबको एक ही डोज पे आप दवाई दे रहे हो, क्या होगा? पुअर वाले में तो कोई इफेक्ट ही नहीं आएगी. इंटरमीडिएट पे हो सकता है कि आपको डिजायर्ड इफेक्ट ना मिले. नॉर्मल पे आपको जो एफिकेसी चाहिए वो मिल जाएगी, रैपिड में मिल जाएगी, एंड अल्ट्रा रैपिड में देयर विल बी द हायर चांस ऑफ toxicity. And imagine if patient is in on a lactation period, what happens next? Reason behind the unwanted effects. So, ultra rapid metabolizers would convert way too much codeine into what? Morphine. This conversation I think we had discussed, right? In very previous first lecture. Theoretically, they should be receiving lower dose to prevent overdose. Now I think this is also making sense. Ultra rapid अगर कोई patient categorized है तो उनको lower dose देना पड़ेगा. Okay, because of preventing overdose. So let's have this case. हमारे केस में क्या था? It turned out that mother in our case was an ultra rapid metabolizer category, and the excess morphine entered her breast milk into her son. So I think now it makes sense, right? Which likely to caused overdose. High level of morphine were found in her breast milk, supporting the explanation. We have included that picture कि autopsy का जब भी autopsy किया गया, result क्या आया था? High level of morphine was found in baby's blood. Okay, so this supporting the explanation कि अल्ट्रा रैपिडली कोडेन का जो है कन्वर्जन हुआ मॉर्फिन में, एंड वो एक पोटेंट एनाल्जेसिक्स कैटेगरी में आता है, एंड दिस इज द रीजन बिहाइंड चाइल्ड डेथ. सी, इस केस के बाद इन 2007 एफडीए ने एक वार्निंग, उस लेबल वार्निंग लगाया गया था आफ्टर दिस केस. So the risk of infant exposure to codeine and morphine through breast milk should be weighed against the benefit of breastfeeding for both of the mother and the baby. Caution should be exercised when codeine is administered to the nursing woman. If a codeine containing product is selected, the lowest possible dose should be prescribed for the shortest period of time to achieve the desired clinical effect. This was the warning in 2006 by FDA. Okay. In 2017, they come up with the amendment. Now, we are now adding a strengthened warning to the mothers that breastfeeding is not recommended when taking codeine or tramadol medicines due to the risk of serious adverse reactions in breastfed infants. This was again the warning in 2017 after 10 years, because the cases were increasing. So this can include excessive sleepiness, difficulty in breastfeeding, serious breathing problems that could result in death also. So that was the concept, and the since this is a very serious problem actually. So back in 2007, the one single line was there. In 2017, the FDA came with the amendment in the sentence, and they directly mentioned that this should be not recommended. Okay. Unfortunately, we just don't know who the right person and people are unless we do a genetic testing. So we can say, is codeine a bad drug? The takeaway from this story isn't to say that a codeine is a bad drug and it should be banned. ऐसा नहीं है कि ये स्टोरी के बाद कोडेन को बैन कर देना चाहिए, राइट? बिकॉज इट इज अ पोटेंट एनाल्जेसिक, राइट? बहुत बार यूज होता है. It is a quite an effective painkiller and if used in the right people. So we need to categorize the patient based on ultra rapid, extensive, intermediate, and poor metabolizer. And this is the structure of codeine again. So this is again another thing to understand कि ऐसे cases के बाद तो ऐसे theory समझने के बाद this is not the conclusion that the codeine is a bad drug, but the importance of this topic is to understand where to use it and where to not. Okay, and for this we need to have a very good knowledge in this field. See, which is still quite expensive. Okay, genetic testing is must, and genetic testing is still quite expensive and has implications on privacy and ethical issue. As I earlier said, ethical consideration is one of our topic to discuss, and we will be having a deep conversation on ethical issues. What are they and how to overcome it? And if you are a healthcare professional and you are facing such issues, how to deal with it? We'll try to figure it out. Okay, we have multiple solutions of it, so we'll डिस्कस दिस इन डिटेल. ओके, एंड वो एक चीज ये भी है कि वन ऑफ द चैलेंज इज एक्सपेंस. ओके, बिकॉज इट इज द कॉस्ट इज हायर. नॉट एवरी पेशेंट कैन अफोर्ड राइट नाउ, बट वी आर ऑल्सो पार्ट ऑफ हेल्थ केयर, सो वी कैन have come up with the ideas, come up with the solutions of something that can resolve these modern issues which is arising from this genetic testing. सिर्फ ऐसा नहीं है कि थ्योरी समझ के एग्जाम में लिखने से या क्लिनिकली एप्लीकेशन करने से सब कुछ ठीक हो जाएगा. यू आर अ पार्ट ऑफ हेल्थ केयर, यू कैन कम अप विद सोल्यूशन ऑल्सो, राइट? बिकॉज ये भी किसी के दिमाग में आया होगा, जेनेटिक टेस्टिंग एंड सम अदर थिंग्स. सो प्लीज अंडरस्टैंड एंड थिंक इन दैट वे. But the problem is you don't know the problem. Okay, so first understand what are the issues and then try to solve it. Okay, that's what our uh, brain needs to do some exercise on. Okay, so this is genetic testing. Okay, so this story is not about just the codeine and CYP26 enzyme. Most of the all drugs are metabolized not in a combination of CYP450 enzymes, and not, we can say they are having a phase 1 and phase 2 enzymes also. So these are the phase 1 enzymes, CYP26, CYP450 family. In phase 2 there are another enzymes. Okay, we have vast category of drugs and we have vast category of enzymes too. So CYP450 falls under the category of phase 1 enzyme, and phase 2, we have TPMP, that is thiopurines methyltransferase, again responsible for 20% responsible for metabolizing another antibiotics or antimicrobials. Another enzymes we are having, that is UGT, that is UDP glycosylonyl transferase, another enzyme, phase 2 enzymes responsible to metabolize drugs. Many of these enzymes have genetic variations that change their functions, altering the effectiveness and resulting into drug toxicity. So, ये एक simple example नहीं था CYP26 का और codeine का, but the picture is very big, okay, as compared to one single example. That was for all understanding of the concept, but we have many challenges in phase 2 enzymes also, TPMP and UGT. So this makes the very toxic effect of the drug. Let's understand further. So we need to do what? Genetic testing with the microscope? No, but we need to understand the genetic testing in detail, that how it is going to be performed, so that economically भी वो sustainable रहे and patient care में एक बड़ा impact लेके आ सके, right? Genetic variations are the major cause of adverse drug reaction. Obviously, you can relate this sentence, and this is a huge burden on the healthcare system. So, what is the possible solution of these two different effects? Genetic variation एक बहुत बड़ा reason है ADR का, and एक burden healthcare system पे. So, what will be the possible solution? One and only DNA profiling or testing. So that this is the picture where you are categorizing people based on their DNA profile good response, no response, bad side effect, and you can categorize dosing regimen as per patient's need, as per suitability of patient, and susceptibility, resistance pattern, etc., etc. And then you come up with the idea of precision medicine, personalized medicine. Where, okay, so this picture is, I think, understandable. Okay, not only it could prevent the baby during from the toxic breast milk, but this is again another picture to understand. See here, the very first mechanism we have codeine. Now the codeine example is clearly fitted in your brain, I assume. So codeine is activated by CYP26. ADR is ultra rapid. अगर category है तो बहुत ज़्यादा morphine में convert हो जाएगा. That can enter into the breast milk. Reason behind child death. Other than that, we have another category. Phase 2 enzyme का example यहाँ पे दिया है. We have a very good drug, azathioprine, right? And azathioprine is inactivated by TPMT. अभी आप सोचो कि इनएक्टिवेशन के लिए हमें फेज 2 एंजाइम चाहिए, टीपीएमटी, ओके, मिथाइल ट्रांसफरेज. नाउ अगर टीपीएमटी में कोई भी गड़बड़ है तो एजाथायोप्रिन का इनएक्टिवेशन नहीं होगा. नाउ इमेजिन पी कि कोई इंसान अगर पुअर मेटाबोलाइजर की कैटेगरी में फॉलो हो रहा है, टीपीएमटी की कैटेगरी की बात हो रही है, तो क्या होगा? Poor metabolizers cannot detoxify, basically breakdown or inactivation of azathioprine, leading to toxic metabolite buildup that damages your bone marrow. This is ADR, okay? Adverse drug reaction. Phase 2. Now we have another example, warfarin. Warfarin again. So see here, some of the drugs are converted into active form with the help of enzyme. Some of the drugs are converted into inactivation, मतलब stopping और excretion को start करना, that will be facilitated by some another enzymes. Both of the examples are written here. Okay, so warfarin is again inactivated by CYP2C9. What happens in poor category? Poor category अगर है, warfarin inactive नहीं होगा, लीडिंग टू हाई वॉरफरिन लेवल्स, इंक्रीजिंग द ब्लीडिंग रिस्क. वॉरफरिन का सबसे बड़ा एडीआर है ब्लीडिंग, राइट, इंटरनल ब्लीडिंग. सो ये बहुत बड़ी चीज है बिकॉज इन एवरी आईसीयू पेशेंट यू विल बी हैविंग वॉरफरिन, हेपारिन वॉरफरिन आप हमेशा देखोगे. एंड बिकॉज एक एंटीकोएगुलेंट होता ही है प्रिस्क्रिप्शन में इन दैट वार्ड. सो दिस इज अ वेरी सीरियस कंसर्न इन दैट वे, राइट. नेक्स्ट एग्जाम्पल एक्टिवेशन का है, क्लोपिडोग्रल. Clopidogrel is activated by CYP2C19. So again imagine poor metabolizer category. क्या होगा? Cannot activate clopidogrel. Patient does not receive its stroke prevention properties. अगर स्ट्रोक वाले पेशेंट में क्लोपिडोग्रेल प्रिस्क्राइब किया गया है एंड पेशेंट पुअर कैटेगरी का है तो क्या होगा? क्लोपिडोग्रेल देने के बाद भी स्ट्रोक. Okay, so this is how, and these are only 4 examples. 2 of them are getting activated by some enzyme, 2 of them are getting inactivated by the help of the enzymes. See here on the right side corner, many more mechanisms are there, many more, n number of mechanisms that includes activation, deactivate, inactivation, detoxifying, etc., etc., with the help of enzymes. Okay, so not only one example, but we have many to discuss. And this is the importance of pharmacogenomics. Okay. Okay, so what are the types of gene drug interaction we are having? Let's understand. See, we have metabolism based interaction. First of all, कौन से type का जीन का ड्रग के साथ इंटरेक्शन हो सकता है? So in very first we have metabolism type of interaction. We have transporter based interaction, we have target based interaction, we have immune related interaction. Okay, so ये जो चार है वो एक कैटेगरी के साथ डिफाइन किया गया है. What it means by मेटाबॉलिज्म बेस्ड इंटरेक्शन जो हमने अभी देखा, एंजाइमेटिक वेरिएशन हो सकता है. फॉर एग्जांपल सिप 450 फैमिली है, सिप 2D6, 2C19, 3A4. सो आफ्टर हाउ क्विकली अ ड्रग इज ब्रोकन डाउन, फॉर एग्जांपल कोडेन, राइट, कोडेन का एग्जांपल यहाँ पे ले सकते हैं. CYP 450 फैमिली का एंजाइम वेरिएशन दैट कैन लीड टू मेटाबॉलिज्म बेस्ड इंटरेक्शन. नेक्स्ट वी हैव ट्रांसपोर्टर बेस्ड. So genes are encoding a drug transporters, okay, that impacts your drug absorption and drug elimination. So अगर transport based interaction हो रहा है, मतलब gene जो responsible है for some of the protein making which are responsible to transport something, तो वहां पे भी interaction होगा. Okay, so these are having interaction with the transporters. For example, For example, we are having SLCO1B1 and some of the statins with it. Okay, so we can say variants or mutations in this particularly SLCO1B1 that can increase your risk of statin include muscle toxicity. स्टेटिन से जो मसल टॉक्सिसिटी होती है वो इंक्रीज होती है अगर ट्रांसपोर्ट बेस्ड इंटरेक्शन होता है तो, बिकॉज दैट आर रिस्पॉन्सिबल फॉर स्पीडी ट्रांसपोर्टेशन. ओके, so this is the mechanism here. The picture is clear. See, the atorvastatin is going into the lumen, atorvastatin, with the help of CYP3A4 or 5 that is converted into your active or inactive metabolites. And this is the intestinal cell, and we have hepatic cell also. So atorvastatin is directly converted with the help of SLCO1B1 gene converted into other forms, and where the CYP3A4 there to convert into active and inactive metabolites. ओके, सो दिस इज द एसएलसीओ जो है, एसएलसीओ जो है वो ट्रांसपोर्टर है, ट्रांसपोर्ट करता है आपका जो ड्रग है उसको इंटेस्टिनियल सेल से हेपाटिक सेल में, एंड विच इज रिस्पॉन्सिबल फॉर इट्स मेटाबॉलिज्म. ओके, सो ट्रांसपोर्ट बेस अगर इंटरेक्शन है तो भी क्या होगा, देयर विल बी हायर चांस ऑफ टॉक्सिसिटी. Another, we have target based interaction. Okay, target based interaction means genetic differences in the drug targets. For example, receptors and enzyme. ड्रग का बेसिकली कौन सा टारगेट होता है, बेसिकली वो ट्रांस होता है रिसेप्टर और एंजाइम, तो वहां पे कोई इंटरेक्शन होता है, राइट. ड्रग टारगेट्स रिसेप्टर्स एंजाइम्स. फॉर एग्जांपल वी हैव VKORC1, उसका इंटरेक्शन वॉरफरिन के साथ बहुत ज्यादा कॉमन है. सो जेनेटिक वेरिएशन इम्पैक्ट योर वॉरफरिन डोजिंग, and that can be the reason behind bleeding. Here is the mechanism in the picture. When it comes to the warfarin, warfarin उसका मेटाबॉलिज्म के लिए one of the enzyme is responsible, that is VKORC1. Okay, and this is responsible for target specific binding. तो अगर वहां पे प्रॉब्लम होती है तो भी जीन का ड्रग के साथ इंटरेक्शन होगा. And another, we are having immune based interaction, where the drug का जो जीन के साथ interaction है, the reason behind is immune system. Okay, and genetic markers are there which are responsible for it. For example, human leukocyte antigen B, which this 57/1 is the ratio, and उसका एक antiviral है abacavir, उसके साथ interaction होता है which is immune related, because this variant specifically 57/1 is increasing the risk of life-threatening allergic reactions. So if you are prescribing antiviral medicine and this variant is present in person's body, then ये जो drug है उसका इस वाले gene के साथ interaction होगा, and the reason behind is immune related interaction. See, this is the side effect which can be occurred because of this particular interaction. This is the real image and published case report image, okay, which shows HLA-B 57/1 variant having interaction with the abacavir, because it's responsible for high level of allergic reactions. Okay, so this is for your understanding only कि जीन का जो ड्रग के साथ इंटरेक्शन है वो बहुत सारी चीजों पे बेस्ड है. ओके, तो ऐसा नहीं कि सिर्फ मेटाबॉलिज्म इंटरेक्शन होता है, बट 80-90% CYP450 फैमिली इज रिस्पॉन्सिबल, एंड अनदर आर ट्रांसपोर्ट, टारगेट एंड इम्यून रिलेटेड इंटरेक्शन पॉसिबिलिटीज आर देयर. आई थिंक इट इज क्लियर. ओके, से ये जो SLCO है उसका जो फुल फॉर्म है वो है सॉल्यूट करियर ऑर्गेनिक एनायन ट्रांसपोर्टर. ओके, विच इज अ फैमिली, and 1B1 is a we can say it is a class which is having the family. Okay, SLCO is a family and 1B1 it is a family member. Okay, and basically this is a protein that is that in the humans which is encoded by the SLCO1B1 gene particularly, and in PGenomic research that indicates which is associated with the simvastatin also. Simvastatin के साथ इसका बहुत atorvastatin के बाद you can have example of this particular thing. Okay, simvastatin and VKORC1 जो है which is vitamin K epoxide reductase enzyme, and the function is very clear, that helps to turn on, means activate your clotting protein in the pathway that particularly responsible to forming the blood clot. Okay, so this is the function of the particular gene VKORC1. Okay, gene provides instruction further to make the protein. Okay, so this is the whole concept. I think this is clear now. CYP450, you know, HLA, that is the immune system related human leukocyte antigen. And we have VKORC1, vitamin K epoxide reductase. We have SLCO 1B1. SLCO का जो full form है वो बहुत बड़ा है, solute carrier organic anion transporter. Okay. Okay. So these are the type of gene interaction. Now let next topic to understand is Human Genome Project. We will be having brief things of Human Genome Project, because when you understand this concept in very detail, it may have two more lectures to understand this. But let's simplify this, because uh, just concept clarity is important for this HGP, right? So Human Genome Project was a landmark international scientific effort that mapped and sequenced the entire human genome. We can say a monumental achievement with the profound implications for understanding human biology. See, these are the aims for human genome projects. Okay, human biology, genetics and medicine, तीन चीजों को combine करता है. And its a key importance lies in providing a foundation for understanding all of the genetic disease, advancing personalized medicine एंड एक्सेलरेटिंग बायोटेक्नोलॉजी. एंड ये जो प्रिंसिपल्स है वो उसको यूनिक बनाता है, राइट? सो ह्यूमन जीनोम प्रोजेक्ट कोई एक चीज नहीं है, इट इज अ कंबाइंड एफर्ट. ओके, जिसने मैप किया हुआ है, सीक्वेंस किया हुआ है कि जेनेटिक डिजीज कैसे होता है. द स्टडीज आर अंडर ह्यूमन जीनोम प्रोजेक्ट्स. सम क्लिनिकल ट्रायल्स आर आल्सो अंडर पाइपलाइन अंडर द ह्यूमन जीनोम प्रोजेक्ट. सो ये जो है एक वी कैन से collective effort hai to understand all of these concepts. Okay, so you should be having idea what it is and what is its importance. इम्पोर्टेंस ऑफ एचजीपी क्या है? बहुत सारे इम्पोर्टेंस है. फर्स्ट इम्पोर्टेंट है अंडरस्टैंडिंग ऑफ जेनेटिक डिजीज. सो जेनेटिक जीनोम प्रोजेक्ट अगर है तो वो सबसे पहला क्या चीज दिखाता है, वो समझाता है जेनेटिक डिजीज का पैथोफिजियोलॉजी एंड हाउ इट इज प्रोग्रेसिंग, राइट? सो जो एचजीपी enabled scientists to identify the genes which are associated with the various disease. See, हमने बहुत सारी चीजें अभी तक डिस्कवर नहीं की है, राइट? We only have few of the things in our hand. डे बाय डे कुछ ना कुछ नया आ रहा है फील्ड में. सो वी नीड टू get the ourselves updated enough, right? So this particular responsible for genes which are associated with the identifying the genes associated with various diseases, including some of the rare conditions, some of common disorders. And this knowledge is very crucial for developing diagnostic tools, treatments and preventive measures for these particular conditions. Next importance. Okay, sorry. Okay, next importance we have, that is personalized medicine. So by understanding individuals' genetic variation, this human genome project paved the way for personalized medicine where treatments are tailored to a patient's unique genetic makeup. Understandable again. So once you know which kind of category patient falls under, then you are having better idea for personalized medicine. Next importance, biotechnology advancement. The project fostered the development of new technologies, including your high throughput DNA sequencing method, which are now widely being used in research and diagnostics, as we earlier discussed in the introductory session, emerging trends, where I had good discussion on biotechnology advancement, right? So in this also, your human genome project has helped insights into the evolution and human ancestry. So, you see, in this field also, this human genome project makes its stands. So the HGP provides insights into the evolution of human population. Evolution कैसे हुआ, okay, कहाँ जा रहे हैं, etc., etc. And that genetic diversity also, helping to trace human ancestry and understand our shared history also. So इस वाले डायरेक्शन में भी ह्यूमन जीनोम प्रोजेक्ट एक इम्पोर्टेंट प्ले करता है रोल. Next importance is revolution in healthcare. So when it comes to the revolution, genomics always stands. Human genome project is always having the major part. So the HGP's findings have revolutionized healthcare by enabling earlier and more accurate diagnosis, personalized treatment plans, and new avenues for the disease prevention. Understandable? And next, importance of your human genome project. advancing genetic research. Okay, so this has accelerated research in genetics and related fields, including bioinformatics, which analyzes large amount of genetic data. So this is also an important role which can human genome project can play. And the interesting topic, ethical and social consideration. The project also raised important ethical and social questions about genetic privacy, discrimination which can be happen, and the implications of genetic information, leading to a greater emphasis on these issues in biomedical research. We will be having a good discussion on ethical consideration, so do not worry. But please understand that human genome project इस वाले चीज पे भी काम करता है. ठीक है. Okay, now understand what are the key concept of kinetics and dynamics with relation uh, to genomics and personalized medicine. What it means, PK, what the body does to the drug. Okay, PK, what body does to the drug. PD, what drug does to the body. You can understand by PD. So D is standing for drug. Okay, so what drug pehle aayega. And PK, opposite, what body does to the drug. So we have key concept here, ADME, absorption, distribution, metabolism, excretion, and genes impact. We have enzymes here, especially the CYP450 family, like 2D6, 2C19, and 3A4, which control your metabolism rate. And polymorphisms in this gene can make someone poor or ultra rapid category, which can have subtherapeutic effect and risk of toxicity also. Okay. And this is the example, codeine, morphine via CYP26, poor metabolizer, don't convert enough, ultra rapid, convert too fast, toxic effect. I think this is clear. And pharmacodynamic, that what drug does to the body, which is PD. And here the key concepts. Drug targets are receptors, ion channels, enzymes, and transporters. And earlier we had discussion on different type of gene and drug interaction, where we understood कि इन सारे जो है ड्रग टारगेट वो सारे रिस्पॉन्सिबल है फॉर जीन एंड ड्रग interaction, not only metabolism. Okay, but PD, dynamic, is also receptors, ion channel, enzyme, and transporters are also responsible for gene drug interaction. What is gene impact? Variation in this target proteins can alter the drug binding and response. Genetic variability can lead to alter the sensitivity or resistance, reducing its efficacy despite of normal drug levels. Okay, so this is how PK and PD concepts are having effect. आई थिंक ये हमने पहले सीख लिया है, हमने पहले डिस्कस कर लिया है. नाउ वी आर ओनली कनेक्टिंग द डॉट्स. ओके, वॉट एवर वी हैव अंडरस्टूड, दीज आर द कंसेप्ट. ओके, इनका अगर एग्जांपल देखें तो वारफरिन, मैंने पहले ही बताया आपको, वारफरिन जो है सेंसिटिविटी इन्फ्लुएंस्ड बाय वन ऑफ द प्रोटीन और जीन VKORC1. There is a vitamin K epoxide reductase enzyme which is basically responsible for टारगेट स्पेसिफिकेशन. एंड अगेन मैंने एक पिक्चर डाला था वहां पे वॉरफरिन के मेटाबॉलिज्म का. सो ये टारगेट के लिए इंपॉर्टेंट है एंड CYP2C9 इज रिस्पॉन्सिबल फॉर मेटाबॉलिज्म. Okay, so see here, this case is complicated now because warfarin needs two of the things, metabolism also, that need PK principles, and that needs to be, a VKORC1 also as a target site binding. सो PK एंड PD दोनों प्रिंसिपल वॉरफरिन वाले केस में आते हैं. एंड हमने सिर्फ कोडेन का एग्जांपल देखा, वेयर ओनली वन एंजाइम वाज रिस्पॉन्सिबल, CYP26, फॉर कोडेन कन्वर्जन इनटू मॉर्फिन. बट सी द कॉम्प्लेक्सिटी ऑफ दिस केस ऑफ वॉरफरिन. यहाँ पे दो चीजें हैं, दोनों को मेजर करके चलना पड़ता है व्हेन इट कम्स टू डोजिंग कैलकुलेशन ऑफ वॉरफरिन. ओके, सो इन पर्सनलाइज्ड मेडिसिन एंड विद रिलेशन टू द फार्माकोजेनोमिक्स ऐसे भी लिखा जाता है PGX. ओके, सो क्या रिलेशन है? पीके टेस्टिंग आइडेंटिफाइज राइट डोज, मेटाबॉलिक कैपेसिटी चेक करने के लिए है. एंड PD टेस्टिंग आइडेंटिफाइज राइट ड्रग, टारगेट रिस्पॉन्स. नाउ आई होप इट इज क्लियर बिकॉज PK ADME डिसाइड करता है. ADME अगर आपने सही से कैलकुलेट किया तो आप राइट डोज पे जा सकते हो कि कितना डोज अप्रोप्रिएट है फॉर स्पेसिफिक पर्सन. अगर आपने PD टेस्टिंग किया है तो आप एक प्रॉपर ड्रग चॉइस कर सकते हो कि हाउ ड्रग इज गोइंग टू एक्ट ऑन द बॉडी. टारगेट रिस्पॉन्स, एंड व्हेन इट कंबाइंस टू ऑप्टिमाइज थेरेपी, तो आप बोल सकते हैं कि राइट डोज, राइट ड्रग टू द राइट पेशेंट, एंड दिस इज ऑल if it combines, that makes the term precision medicine. Trust me, practically it is quite difficult to practice this all the time in all the patient. Sometime we should we have to follow some of the predefined guidelines, and some previous cases and the history, etc., etc., and we have to assume that this will be having the good amount of dose to the right patient with the right drug. Every time it is not possible, but many of time we can. Okay, so there is always a ray of hope, and this is the concept of it. PKPD. Okay. Okay, what are the role of genetic variations in the drug response? So genetic variation, meaning mutation, duplication, etc., that plays a crucial role in determining how individuals respond to drugs. And this field of study, known as pharmacogenomics, now it is clear, aims to understand how genetic differences influence your drug efficacy, toxicity, and metabolism. I'm repeating again and again the same thing because uh, after this lecture, we will be having some great concepts, okay, by the next Wednesday. So I sincerely hope for the basics should be very very clear, okay, because this PKPD directly stands in the upcoming concept theory. So you need to understand कि how कैसे इनका relation है with PGX. Okay. The ultimate goal is to personalize your medical treatment. This is our ultimate goal based on person's own individual genetic makeup to improve the outcomes and minimize the adverse effects. Key genetic factors which are influencing drug response. क्या क्या है genetic factors? Very first we have metabolizing enzyme. Okay, CYP CYP450 family. So that can be have poor or ultra rapid category. So these are the reduced efficacy and risk of toxicity examples. So very first genetic factor, that is metabolizing enzymes. Next category, transporters. For example, SLCO1B1. This is another reference book content. So that I again repeat this because to understand the various category of pharmacodynamics. Okay, this is dynamics. So genetic variation in transporters like SLCO1B1. Statins का example है वहां पे. Drug target receptors and enzymes. For example, variants in the VKORC1 affects the sensitivity of warfarin. Blood thinner है ये, and patient with certain this genotype that requires lower dose of warfarin as compared to normal individual. Okay, target specific है ये. And HLA, that is human leukocyte antigen genes, which is immune system related drug gene interaction. So certain HLA alleles are linked to have severe drug reaction. For example, the category 57-Gem1 is associated with the hypersensitivity when it combines to abacavir. Okay, anti-retroviral used in HIV treatment. बहुत HIV के पेशेंट में आपको ये ड्रग मिलेगा. Genetic screening is mandatory before prescription. एबिकाविर अगर प्रिस्क्राइब हो रहा है, जेनेटिक स्क्रीनिंग इज वेरी वेरी इंपॉर्टेंट बिकॉज पेशेंट को डायरेक्टली हाइपर सेंसिटिविटी हो सकती है, राइट. Extremely allergic condition can be arise. Importance of it. What are the clinical implications? So we need to do dose adjustment first of all. So genetic test guide dosing, warfarin dosing with ciptocyanine and VQRC1 testing. Example, drug selection. So avoid drugs with known risk in genetically susceptible individuals. Patient अगर अल्ट्रा रैपिड है, कोडेन नहीं देना है, या फिर नॉर्मल जो डोज है उससे कई ज्यादा कम डोज प्रिस्क्राइब होगा, राइट. Preventing ADRs. Many ADRs can be prevented through this genetic testing. These are the clinical implications. Okay, in daily practice कैसे हो सकता है ये दिखाता है ये slide. And what are the challenges in clinical implementation? Complex polygenic influence. Okay, because polygenic का मतलब क्या है? हमेशा ऐसे simple conversation नहीं होती है जैसी कोडेन की है. जैसे कि कोडीन is getting converted in the morphine by CYP26. ये very simple example it is, but sometime it is polygenic. More than one gene is involved in the mechanism. Drug response often involves multiple genes. तो ये एक challenge है कि आप कैसे identify करोगे, right? For example, warfarin दो चीजें हैं उसके पास, VQRC1 SLCO, right? then excess and sorry then ethnic variation है, genetic variants vary in frequency across population, ethical consideration की बात है ये, social stigma भी एक reason है, एक challenge है, access and cost, genotyping is not universally available or affordable, as we earlier discussed, and clinical guidelines. So we have good guidelines to follow, as I earlier said. um, हर बार हम जेनेटिक स्क्रीनिंग के लिए नहीं भेज सकते हमारे पेशेंट्स को, बट वी नीड टू हैव गाइडलाइंस इन आवर हैंड, जैसे कि सीपीआईसी। इन इंट्रोडक्टरी लेक्चर ऑल्सो आई हैव इंक्लूडेड सीपीआईसी, द क्लिनिकल फार्माकोजेनेटिक्स implementations consortium. Okay, this is the full form of it, clinical pharmacogenetics implementation consortium. And we have another protocol, that is farm gkb, the full form of it, that is pharmacogenomics knowledge resources. Okay, pharmacogenomics knowledge resources, and particularly this farm gkb encompasses the clinical information, including the clinical guidelines and the drug labels, potentially we can say clinically actionable gene drug associations and genotype phenotype relations are mentioned in the farm gkb. Okay, and these are still in evolving stage, but we need to understand that cpic बहुत हद तक हमें हेल्प कर सकता है to understand these concepts. So these are the challenges in clinical implementation. जब आप practical implement करने जाओगे ये principles, तो ये चीज आप शायद face कर सकते हो, right? Future direction. So, whole genome and exome sequencing that may reveal the comprehensive drug response profile. These are future trends. We need to have AI and bioinformatics tools also that will help to integrate multi-omic data for the better predictions. We'll have future direction in our upcoming lectures. We will discuss 30 minutes कि AI क्या role हो सकता है genetics में. Okay. Personalized polypharmacy management could again can be a part of revolution treatment in chronic and geriatric patients. Personalized polypharmacy management, because unnecessary दवाई को avoid करना. Polypharmacy is also biggest challenge in India right now in geriatric patient. Okay, so we'll discuss this. These are the future directions. Points to take home for today's session. So you need to understand importance of genomics based on case study. You need to understand Human Genome Project and its importance in various field. Then the role of genetic variation in drug response, किस चीजों पे हो सकता है, and the ethical consideration, which is a part of our next session, will understand. And the third that is the key concept, kinetics and dynamics. You need to understand. Okay, so these are the parts of the session that need to have revision. Okay, so this is the end of our session today. I think आज बहुत जल्दी session खत्म हो गया है. I think we have good time for question and answer, which is my favorite part of the session. So do you guys have any question and answer? Question है कोई? So we have ample of time today to discuss everything. Okay, no one has doubt? Strange. I hope you are not sleeping. Okay, I can wait for 2 more minutes if someone is analyzing what to ask.
Hi, Neha. Right, Neha. Hi, this is Preetham.
Hello.
Yeah, so in the studies, because it is everything is about gene.
Yeah.
So, what is the occurrence of incidents of adverse reactions or something like that, or showing that impact of that medication
Hmm.
in a population of 100 people in clinical trials. So, say for example, we have 10, 100 that medication was given to 100 patients, and out of that 100 patient, how much patient we get this information from? What is the turnaround time or something like that?
See, this is a very good question actually, and a very good topic to understand again, because when you are delivering the same dose to 100 patient and how to analyze it, that's what you want to do, right?
No, no, not how to analyze it, but this impact of
Impact
gene
of particular.
on that patient. Say, for example, out of 100 patients, how many patients will we come to know that what are the impact and what is the impact? When you say, for example, 10 patients will have impact from genes, right? All 100 patients will not have impact from genes. So that number I want to, that percentage I wanted,
Okay,
apart
so
from your
see
patient.
okay. So basically we only have one possible solution for it, that is genetic profiling and genetic testing. Okay. See, many of time what happens, only 1 to 2% category falls under the very rare, condition. So when it comes to 100 people and 100 people are receiving the same dose and only 10 patients are having the reaction, which is not unlikely reaction or unwanted reaction, the only possible solution to overcome it, that is the DNA profiling, right? And before the genetic testing, there is no way to understand this. That is the challenge of genomics,
Okay, thanks. And
right?
one more
Because
question. So
there is no way.
how will,
Mhm.
may I ask?
Yeah, yeah, sure.
So in most of the Dr. Ajit's courses, I am the first one to question, so it's okay. So
Okay.
though how does it impact in the rare disease therapeutic area? Because rare disease are very few people.
Yeah,
Uh,
very few, very few.
so if it is a rare disease and if we know the genetic profiling of the patient,
Hmm.
so can we prescribe the medications in a proper format to get that ultimate results?
There is
What is the take
always
on that?
an okay. So once you have the genetic testing profile and test results in your hand, then there will be always checking the risk versus benefit ratio to prescribe any of the medicine. And it comes to the rare condition where the chances of saving patient is very less, then मैंने जो मेरे experience से देखा है, there will be always a, low dose में the same medicine is prescribed, but in the low dose, so that it has less side effects once you have the genetic results in your hand. So after, you need to check the risk versus benefit ratio of the patient, and if it is in a serious condition, you can go for less dose, less frequency, more intervals. In that way the dose is prescribed.
Thanks, Dr. Leo.
Thank you. No, it is not affordable for everyone. I think someone asked that is it only way, but it will be affordable for everyone to providing personal. No, it is not, and that is the challenge in genomics. Ki there is not affordable and not available to overcome. And we will see that what are another challenges in implementing genetic testing. You cannot convince people sometimes, right? To convince is also a challenge. We have a good position called the genetic counsel. Is one position also, which is a genetic counselor. That is the designated post, which is specifically dealing with genetic test results, coding and interpretation, and advising you further what to do and what to not. So this is also new and good position that can help patients and sometimes clinicians also to understand genetics.
Am I permitted to add to your statement something?
Yeah, yeah, sure.
So, in the Indian paradigm, genetic profiling or genetic thing is a very costly affair, first of all. And very few, rather one, two organizations does this genetic testing in India. They do it
Very true.
very with this, and majorly patients with multiple alignments, patients whose understanding is in that way people give, and it is not to the common mass. It's in the elite group still now. people are not for the people like us, to be very frank and simple. So it's costly, true. It's very few thing, and it is not on the part of numbers, but definitely there are a lot of other parameters to be taken care of to perform that genetic testing. It's not that कि आज हम लोग कुछ थोड़ा सा कुछ स्पूटम ले लिया और दे दिया, ऐसा नहीं है. वो स्पूटम देने के बाद ही there are multiple ways of
Exactly.
storing it to get that proper genetic thing. Otherwise it will not get, माने results ही नहीं आएंगे proper. तो ये मेरा थोड़ा just to add. Thank you.
Precisely, precisely said. Because many of things are there. I think in our upcoming lectures, I included, the report, how it looks, and one case study also, that what is the exact mechanism, okay, exact the flow of genetic testing. Because one of my friend is genetic counselor. She is my good friend of mine, and working as a genetic counselor since last 5 years in United States. And she is in contact with me, and we were doing a conversation, and that's where the importance of genomic comes into my mind. So I asked her that send me the few cases which you have experienced in your career, and the flow of the genetic testing, what it needs and what needs to be done, how to convince patients, and what are the interpretations, and kaise hota hai. I am also eager to learn that thing, and I have included in our course. So I want to share that knowledge with persons who has interest in this genomics, right? Because it sounds very, this is very crazy, and this is very interesting term to understand. So do not worry, we have still 10 lectures, and I think now the 9 lectures, and we'll understand each of the aspect of genomics in detail as much as we can.
One more thing. Sorry, I cannot come. I could not come on video because I am walking. Actually, I'm coming back from walk. So video will be a little different, and I did not put on my video. Normally, put on my videos, but this is sorry for that. So, thank you. Next time, maybe. Thank you.
Thank you. Okay, any other questions from anyone else? I think no. Okay, yeah, you can have your dinner. See you guys on next Wednesday. Thank you for connecting. Thank you.